At this point, I am very happy to be able to introduce to you Dr. Prospera Tedam, who previously taught social work at the Open University of Northampton and Anglia Ruskin University before she joined the Department of Social Wellbeing at the United Arab Emirates University. Her research has focused on culturally sensitive social work, equality and diversity, anti-oppressive practice, faith-based abuse, and the experiences of Black African social work students in practice learning. Her recent book introduced the 4D 2P framework for identifying, understanding, and disrupting oppression in social work encounters. The aim of the framework is to assist social workers to understand the steps through which they can evaluate their own non-oppressive practices on an ongoing basis. So at this point, I'd like to welcome Dr. Tedam.
Thank you very much, Kathy, and thank you to everyone for joining us and making the time to join us today. As I said earlier, or perhaps not to everyone, I'm joining from the United Arab Emirates, and I'm delighted to be sharing this segment of our discussion with you all. So I'm going to be talking briefly about social work education and training, or social services education and training, in and beyond the pandemic. And I think what's important to say from the outset is that there are a lot of similarities between what's been said already from Kathy, who introduced and who's moderating this event, but also from what Hugh and Heather have shared in their various presentations. So by way of introduction, I just want to take us to this quotation by McLaughlin, scholar and teacher last year, who talked about the terms social distancing, lockdown and quarantine gaining global meaning. And so I think from that point, we all agree, or we all will agree, that we continue to use those terms, social distancing, lockdown and quarantine. And what's interesting about the way these terminologies have made it into our daily language is that we now use them. I think many of us use these terms very often and without having to think. What happened at the very start of the pandemic was that no one knew what to do, I think is a fair way to put it. And not only were we all concerned about what was going to happen immediately to us as individuals, with our families, as social work practitioners started thinking about, and social service practitioners started thinking about service users, or clients as they may be called in other places, vulnerable people, and how those groups of people may continue to receive support during the pandemic. Another group that were perhaps not immediately thought about were students, because we thought initially, from the perspective of social work educators, we thought, okay, a few lessons on Zoom, a few online bits of training and sharing your notes via the online systems would be all that was needed. And so I guess it was with shock and horror that the majority of us as educators began to see that this was going to be long term. So if you were trying, as we say, to wing it initially, if you were trying really hard to get by, this was going to be a longer term impact, and we had to find ways of ensuring that we were responding to students and learners' needs. So I'm going to be talking about the impact of the pandemic on education, the process of education. I'm going to be talking about the impact of the pandemic on the people, so us as the educators. And then I'm going to be talking about the impact on students and learners. And whilst I've got service users, clients, and communities on this slide, I want to acknowledge that the impact of the pandemic goes beyond our learners, our social services learners, but also impacts obviously on service users and clients and communities. And you've been having some of those discussions in your group. Certainly the group that I've just been in, we're having discussions about the impact on their own practice, on service users, and how they had to work, they had to use innovation to move beyond some of the difficulties they were experiencing. So in terms of the campus or on-site education, we know that there were significant access difficulties. Issues around space suddenly became really important for students and for learners. And this was around learners who didn't quite have access to quiet or unused spaces at home. And we heard from students, and I should probably just give a slight backdrop to this, was that I undertook some research at the early days of the pandemic about how students' practice learning was affected and how practitioners of ethnic minority backgrounds were experiencing their work during the pandemic. So I've got some, if you like, I've got some empirical data to support what I'm saying today. So access difficulties by students who didn't have quiet spaces or unused spaces at home was a key challenge. Students with families, whether their own or others, especially students with children who also started to be homeschooled near and around the time where they had to work from home and also think about what learning they needed. This created tension in many of these places. And I do know of a number of students who then had to pause their studies when it became apparent that they could no longer carry on trying to support their own children through education, through the lockdown, and gain their own social work, social services qualification at the same time. It's also important to talk about the library. I know that the library is no longer a physical space, but there were a lot of students and a lot of learners who use that physical space for different things. They use the meeting rooms in the physical libraries, and they often said that, ebooks were limited, and, when there's 20 people logging onto one ebook, it says there's no more capacity. And so libraries and other resources were difficult to access. Ebooks were limited at some university sites, and students felt that their learning was disadvantaged by this. So by the time students made, if you like, a request for additional e-copies of a particular book or text or resource, it took time for that request to be formalized, agreed, and then actioned. We've already heard through the other speakers the whole idea of digital and other forms of poverty, access to laptops, computers, software, etc. And we do know as well there were some families that shared a laptop, children and parent who was also studying. They shared a laptop, and there was certainly one case that I documented about a learner who had to connect to their laptop through their telephone hotspot. And these are new. Some of these words were just new to me. What is a hotspot? What does it do? How do I get it? And a lot of students felt, or a number of students felt, that they had to be creative in using different ways to gain access to the internet. Of course, the feelings of isolation and the absence of traditional peer group support, especially for students from minority groups. And there's a whole body of literature and a whole body of research around isolation in relation to the COVID pandemic and what it did for particular groups. And we're not talking specifically or only minority groups. Certainly that's where my research interests lie, but a broad range of students experienced dislocation and isolation from what they would consider peer support groups. And of course, service user contributions to social work education, and I'm talking now specifically about parts of the UK where service users are an integral part of social work education. They were no longer able to come to campuses. They did not want, and in many cases were not able to sign on to some of the, if you like, the platforms, the virtual platforms that we've used and continue to use in this pandemic. And moving swiftly on now from looking at the university-based or the site-based approach and looking at field learning and field education, practice learning, we know that delays threatened student progress and attainment for those in final years. So there was a lot of conversation around, do I just hang in there and just go with the flow and get what I can in terms of a placement and still graduate? Or do I take a pause in my studies now because I'm experiencing all these hurdles? Do I take that pause? And then there's a threat then to how quickly I'll progress and complete and attain my qualification to start working. So lots of things in relation to practice learning. And of course, the field educators and the placement sites were waiting for this guidance that was often changing. It was very fluid at the time. In fact, for a very long time, there was nothing. People didn't hear anything about what was happening. And then suddenly, information and guidance became available, and the guidance was changing quite rapidly as well. Again, in the area of practice learning or field education, there was heightened inequality in relation to the availability and allocation of practice learning opportunities. That's cited, I'm citing myself there from my own study. And we've talked about in the previous Heather's session, we briefly mentioned the whole idea of inequality, and that was heightened in relation to what placements then became available and who was being offered those placements. And I think that is definitely a discussion for another time, but I know my colleague will be talking about social justice a bit later as well. And there was uncertainty for many learners about the assessment strategy. So what does a good assessment look like now? So I'm going to be on camera. If my internet fails and I'm not on camera, will I pass? How am I supposed to do this presentation now without the formal setting of being able to walk around and engage my colleagues? What am I being assessed against? Has that changed? How will my practice supervisor assess my engagement? How will they assess my nonverbal or my body language? How is that going to work? And the quality and type of supervision was again, for many learners, not what they would welcome. And many learners would say supervision's halted for many of them. But for those that were close to qualifying, they had some sense of online supervision, distance supervision, telephone supervision, which they felt was not the same, and that those supervisions focused purely on how are you getting on in the pandemic, which is right, and very little to do with their own kind of progressing placements and progressing that practice learning. Again, this has been mentioned certainly in the group that I was on just now, the virtual and online placements, students reported feeling anxious about confidentiality while working from home. So there was an example given of a student, a learner who said, I did an online visit, as it were, and the service user, the young person I was working with, took me all around the house and said, look, this is my bicycle, look, this is my kitchen, now can you show me yours? And the learner feeling that they hadn't been equipped by the university about this form of confidentiality while working at home. So what she had done, which I think was quite interesting, was that she went outside to her garden and said, these are my flowers, this is my back garden, this is where I sit to have, a cup of tea. And so she talked about having to learn on her feet about what could get her into trouble and what could not, what was confidentiality when you're working in that way. And also just the confidentiality arising from other people being in the house, other people being in your space, or being in the space when you're trying to speak confidentially about people's concerns and people's needs. Whilst there was the risks were there, the challenges were there. I think that there were a whole host of adaptations, but the one that really has sat with me, I think, is this adaptation, this approach from Northern Ireland. And I think that somebody mentioned that it happened elsewhere. I can't remember the country, but I think that was Hugh in your talk. You mentioned this as well. But certainly in Northern Ireland, they withdrew their final year students from placements and recruiting them immediately into the social services workforce. And I think that's really innovative. When I've discussed this particular adaptation with some of my colleagues, they have then said, well, what if that was so good or so effective? that then we make a case to reduce the number of placement days or practice learning days. So you can see that whilst this was a great adaptation, and I've got a YouTube link for people to listen to this adaptation, I think it could potentially also bring about a debate about, do we then need that many in practice days on placement if in the final year you can become a practitioner, so to speak. And so I think those conversations are important and most definitely should be had. So beyond the pandemic, what have we learned? What have we experienced that can take us beyond the pandemic? We know that the pandemic is not yet over. We are still working within the pandemic, but in many places, things have loosened up. I understand in certain places, masks are no longer a requirement. Where I am, masks are still a requirement. And again, social workers will say, you can't even smile, no one sees your smile. So what's the point, and so thinking about those. But beyond the pandemic, we've created, or learners have certainly created, shared learning spaces with diverse groups of people. And this online learning space and time, as we're experiencing today, we're connecting with so many people around the world from so many different countries. And for a learning opportunity for students and learners, this has been an invaluable source of shared learning, where they go onto webinars and they're put in groups like what we've just been doing today, and they can talk about practice from their countries, from their areas. And I think that's a really exciting way going forward. Of course, creativity within practice, as our social services practitioners will tell us, and of course with university learning. We also have to think about the formation of the different types of peer and collegial support. So you can agree to let's have a coffee over Zoom. And that's become a thing now, where I can have my cup of coffee, you can have yours, and we literally have a coffee over Zoom. So the different kinds of support are available and have been formed through the pandemic. And I think that this will go into the future as well. Again, accessibility of training and support. We know lots of webinars that are online, many are free. Even if they're not free at the point they're done, you can always go back and watch the YouTube or clips of it and snippets, and you can do that on the go. So let's be honest, you could, if your camera's off, be doing something else within the home and still gain some valuable learning alongside. But what the pandemic has done has brought into sharp focus the inequalities that exist, and actually increase the learning awareness of the impact. Because prior to this, I think that there was some areas of research, if you like, that didn't necessarily interest everyone. But given what we've seen with the pandemic, the impact on particular groups of people and the vulnerability there, the ones that have been more adversely affected and so on, we're beginning to see those inequalities, and people are beginning to learn, and it's created awareness of the impact of inequality. And finally, I suspect that many of my colleagues, practitioners, learners, and academics alike, will have discovered some hidden talents, skills, and interests. And I think that is an important point, to make it, here, because we're also thinking about how people have responded to managing stress, self-care strategies, as has been mentioned earlier. Who would have thought of, Zumba on the, watching your YouTube and doing Zumba or Pilates or yoga? You would physically want to wrap your mat and walk to the space where it's been done. You can do it in your front room. So I think that we've all, discovered some hidden talents, some skills, and our interest have perhaps expanded. Okay, so I'm going to leave you with these references that you might want to look at, explore further, and particularly if you're interested in the innovation I talked about from Northern Ireland, Queen's University in particular in Belfast, where social work students were put into practice and pulled out of field education. The YouTube link is there. And before I hand over to Kathy to remind us about how the breakout rooms are going to work, I guess they're similar to the first, but she'll give us a reminder. I just want to go through these questions that we'll be taking and discussing in our breakout rooms. So the first question I'd want people to just reflect upon: in what ways do you think the online/virtual placements and field education will impact on qualified practice? Second question, from an employer perspective, what additional training, if any, would you offer to new social service practitioners who join your organization during and after the pandemic? The third question will be, how do you think the pandemic has exacerbated inequalities for various groups in social work and social services, education and training? So at this juncture, I will pass you back to Kathy, who will just refresh our minds about the breakout room process.
Thank you very much, Prospera. You clearly have highlighted what heroes our students have been as they've tried to navigate incredible times, and how I think in many respects we have benefited. So we will now move back into our breakout rooms. You'll be placed in the same breakout room as before. Remember, unmute yourself, turn on your camera, and don't forget to add any key reflections from your session on the Ideas tab on Slido. And remember, your discussion questions can be found in Slido as well as in a participant pack if you received one. So we'll head off to our breakout rooms.
Of the rooms. But the first comment I want to address is this: I don't want people leaving here saying I have said nobody knew what to do, full stop. I did give some context to that. So the comment on Slido, I gave context to that by saying that I had undertaken my own research. And so can I just put that into context? So within those participants, they had suggested that because of the fluidity of the situation, the ever-evolving situation, nobody really knew what to do. And that really comes from there. So I know it's not fair to say that, and I didn't say it in that way. So I just wanted to correct that, that view. I think that, Kathy, one of the things that I've picked up going through them is there's a lot of concern, there's significant concern about social workers who are coming out into practice. And the real question is, do those practitioners feel ready, able and prepared? And I heard that theme across the rooms as well. It's really down to, do we think this group of, not about necessarily do we think they're prepared, do they think they're prepared? So I suspect that might be a useful starting point for employers and people who will be interviewing prospective social services employees to really think about asking that question about how prepared they feel, especially if they have undertaken a period of online placements. And the other concern was that some learners will have their entire practice learning experience online because of when the patterning for field learning takes place in some universities, that some people will almost certainly have both placements or two placements virtually, and is that sufficient? And I personally know somebody who's deciding to stop and come back when placements become what placements used to be, or field learning becomes face-to-face because of that reason exactly. Again, thinking about what's happening in certain places, the whole idea of the internet, availability of the internet. Just in some places, in one of the rooms, there was conversation about, and the person who contributed might want to correct me here, but there was it a government or a federal legislation or a local legislation about Wi-Fi, because it was so slow with that many people drawing upon the same source, that they had to legislate around it. So there's things like that people perhaps didn't consider right at the start of the pandemic. Learning online is good. I think people have said the hybrid model can be good. does have its advantages, but nothing beats, as people are saying, nothing beats the face-to-face, nothing beats, you know, going into a room, meeting people, and being able to assess what you see. And I think somebody said, you know, I'm not sure whether I'm old-fashioned, but I still prefer the old kind of face-to-face. And I think that sentiment was quite present in many of the rooms that I visited. There was one group as well that talked about there needs to be better collaboration and connection between social services providers and the universities. So, you know, there needs to be a better arrangement, a more robust arrangement that means that social students don't feel shortchanged, but also that employers in the future don't feel shortchanged. So that connectivity, if you like, that working together was mentioned in one of the rooms as well. The other issues were generally around how would a student, a qualified practitioner, view themselves professionally? And I think that comes back to what I was saying. What does a qualified practitioner look like? What are the experiences you need to have whilst you're training to give you that certificate, to give you that qualification, to make you feel able to practice in that way? And then, of course, there are the other things around the cost to students who then delay, whose placements are delayed. Who's funding that? Is there a funding gap? Have people stopped receiving financial support? Did they ever receive financial support? And who pays for these additional years? And then, of course, there are areas around what happens if a student, what does a learner who fails a placement, what does that look like? And do universities, or have universities then opened themselves up to challenge from such students saying, we were, you know, practicing in unprecedented times, you know, how come I've failed, or you've asked me to repeat this placement and this area of learning? So I think for me, what I've picked out from all the rooms is that a real sense of, yes, we had to do what we had to do to get by, but it would have been downright better if we were all physically in a place, learning how to work with people of various backgrounds, understanding what it means to, you know, develop and start a relationship. And I think somebody tongue-in-cheek said that that would be a good, I don't know how it was phrased, that would be a good assessment. How is empathy developed virtually? And I think somebody says that's a good training course. And you know, I echo that. Are we then thinking about different ways of doing things on a permanent basis? Or are we saying these changes will only last up until we've seen the back of COVID?
One of the things I might ask you about is the whole accessibility issue. I've heard people talking about, well, they have the equipment, but there's not connectivity. Is there a policy issue to be worked on there within countries?
I think there is, Kathy. You know, again, we're back to some of the things that higher education institutions or education providers really need to think about in terms of this. Yes, you may give me a laptop. I may be able to sign out a laptop from the library and, you know, use it for the duration. But if I've got to connect the internet to my phone on a hotspot, which was the new word I learned this season, and then subsequently have an increased phone bill, who pays for that? Indeed. And that is in addition to everything else that I've paid. And many students will also say that, you know, they haven't had a reduction in fees. Some haven't even had a reduction in hostel accommodation, you know, despite the fact that many didn't live in them for periods. Some had a 5% reduction and so on. So I think there's a real need to think about, in the longer term, some kind of legislation for similar occurrences, and to say who picks up the tab for this. It shouldn't be the students, and certainly shouldn't be the students many of whom are already struggling.
Thank you, Prospera. And thank you again to all the participants. We've just started unpacking these issues, and we'll keep that conversation going.